Hello, my name is Laura O'Reilly, and I am the Executive Director of the North Jersey Health Collaborative. We are here today, thanks to a generous grant from ScreenNJ, to offer a webinar on cancer prevention screenings. Today, your presenter will be Mary Ellen Zung, health educator. Thank you, Mary Ellen.
Thank you, Laura, and thank you everyone for taking the time to watch and your interest. I know cancer can be a scary topic, and my goal here is to give you a better understanding of cancer, how it starts, and how you can protect yourself and your loved ones with screenings. So today we'll cover in 3 parts: cancer basics, lung, colorectal cancer screenings, who's at risk, who should be screened, what screening involves, and where to get screened in Northern New Jersey. And the 3rd part, we'll talk about the things you can do in addition to getting screened to help reduce your cancer risk. So let's start out with the cancer basics. We'll go over what is cancer, why do we care, what causes cancer, cancer development, how cancer spreads or how cancer survives, and benign and malignant terms, and metastatic cancer and what that all means. So what is cancer? There is no one cancer, and cancer can start anywhere in the body. What we know is that normal cells die when they're damaged or old, and cancer cells don't die when they should. And by continuously forming and growing, they can create tumors. And most cancers do form solid tumors. Why do we care about cancer? Well, we care because New Jersey has some of the highest incidence rates of cancer in the country. In a 2014 report, the New Jersey incidence rates for all cancers combined continue to be higher than the US rates. And in the state of New Jersey, we saw over 250,000 new cases of cancer in this 4-year period. And of course, not a subject we like to focus on, but it's reality: over 80,000 deaths in New Jersey from cancer. There are various causes of cancer, and some factors put us at increased risk. And these include familial risks, but also chemical exposure, sunlight and tanning beds, certain viral and bacterial infections, smoking, and sometimes cells just don't divide properly. But in all instances, the major driver that turn normal cells into cancer cells are changes that happen at the genetic level. And the next few slides will differentiate between the hereditary or the familial risk factors, and then sporadic risk factors. So the 2 types of risk factors when we talk about cancer risk, the hereditary, and those are passed down from your biological parents and maybe passed to biological children. And you can't prevent these genetic changes, but you can understand what cancers you may be at higher risk for. And then the sporadic risk factors occur over the course of a person's life and can increase cancer risk. And some of these are called modifiable factors because you have the ability to change certain behaviors that create increased risk. So for example, smoking. And we'll talk more about these in part 3. And an example of a non-modifiable risk is aging, which is a major risk factor that can't be changed. Everybody's aging. Hereditary cancers account for 10 of all cancer cases. And an example of this, while it's not always possible to know your family history, you can use genetic testing services to find out if you carry a gene mutation. And this will show you what cancers you might be at higher risk of developing. And just an example of this is breast cancer, the BRCA gene. It doesn't cause breast cancer, but you could be at a higher risk of developing it. And risk factors should be discussed with your primary care doctor at your annual physical. I wonder if you've had a physical in the past year. I find sometimes with my clients, they've not had a physical because they don't want to know any bad news, or sometimes they just don't trust the healthcare professionals. So please make sure you're getting your annual physicals. So it's much more likely that a combination of these sporadic risk factors is the reason that a person develops cancer. Oftentimes, people believe that cancer runs in a family. And as we noted, in a small number of cases, that heredity does play a major role. And the cause of cancer is more likely to be due to sharing certain sporadic modifiable risk factors like learned behaviors instead of it being hereditary. And these behaviors lead to genetic changes that happen over time and lead to the development of cancer. And it can take years for this to happen. So we don't really notice that it's going on, right? Tobacco smoking, excess weight, alcohol use, UV rays, poor diet, infections, lack of physical activity. And as I mentioned, we'll talk more about these. Since cancer takes years to develop, we consider cancer development in 3 phases of carcinogenesis. And this is just a fancy way of saying when normal cells are transformed into cancer cells. So think of genesis. And these phases include initiation, which are the first cells to mutate, then promotion, which is the proliferation of the cancer cells. It's during this phase that we screen for cancer prevention. And here's where we're doing mammograms, pap smears, and looking for abnormal cells. Cancer prevention activities can prevent and detect cancers early. We think of when we get a promotion, it's a good thing, moving up and moving on. And with cancer development, they too are moving on, not a good thing. Progression is the last phase in tumor growth. And this is when the tumor progresses, becomes more invasive and aggressive, and can metastasize. And people are afraid sometimes to get screened because they think they'll find something. But if you find something, you can do something about it at that early stage. Cancer prevention runs through the initiation and promotion phases. And this is when cancer screening is the most effective at helping to contain and prevent the cancer from spreading. And because it does happen over time, cancer and tumor development is defined in stages. There are 4 stages of cancer development. And this is a very basic overview of the stages of cancer. In stage 0, abnormal cells have been found, but since they haven't spread to other tissues, they're not considered cancer. And in stages 1 through 3, cancer has been diagnosed. The number represents the size of the tumor and if it's spread to a nearby tissue, for example, from your finger to the palm of your hand. And in stage 4, the cancer has metastasized, which means it is spread to other parts of the body, including faraway parts of the body, like breast cancer spreading to a leg bone. As I mentioned in the previous slide, we want screening to take place before and during stage 0 in order to catch the cancer before it develops. Cancer cells create their own microenvironment. They don't get along or cooperate or play nice with other cells in the body. And this tumor microenvironment is how cancer cells ensure their survival. Cancer cells don't have distinct specializations like normal cells do in the tissues that they're developing in. So, for example, a tumor cell that's growing in the liver doesn't act exactly like a liver cell. So it will be inhibiting the function of the liver. And these cancer cells compete with the healthy cells and deprive the healthy cells of nutrients. And what's amazing is that cancer cells can influence normal cells to create blood vessels to supply the tumors with blood, nutrients, and oxygen, which allows them to thrive and grow. But not all tumors in the body are cancerous. So just wanted to make a distinction between benign and malignant tumor cells. Benign tumors don't spread and generally don't grow back when removed. Even though benign tumors are not cancerous, they can still grow quite large and be life-threatening. If they're in the brain, for example, the brain is a closed cavity and a tumor would press on the sensitive tissue of the brain and cause damage and even death. In other parts of the body, like the abdomen, tumors have a lot more room to grow because they're less restricted by the soft tissues around them. And cancerous tumors are called malignant and can spread to other tissues in the body. Cancer cells can travel throughout the body by blood and lymph and form tumors in other areas. And metastatic cancer is cancer that spreads to other parts of the body, including distant parts. Metastatic cancer will be called by the original or primary cancer. So if you have breast cancer, but it metastasizes to the lung or the brain, you have breast cancer. Okay, now let's review the screening guidelines and types of cancer screening for lung and colorectal cancer. Cancer screening is used to detect abnormal cells before they become cancerous. Remember in the cancer development slide where we want to screen people during proliferation, this is when the abnormal cells start growing. And that's because we want to screen before the cancer or tumors develop. So that's my goal for you, is to understand why we screen, when we do, and what the impacts of screening are in preventing cancer and cancer deaths. Lung cancer is the leading cause of deaths due to cancer in New Jersey and in the nation as a whole, with about 9 out of 10 people with lung cancer dying from the disease. And this is in part because it's often not diagnosed until after it has spread outside the lungs, making early detection incredibly important. More than 8 out of 10 lung cancer cases in the US are from smoking. And lung cancer is also the most preventable cause of death. So if you have a history of heavy smoking, for example, 20 pack years, which is a pack year is the number of packs smoked per day multiplied by the number of years smoked. So an easy example of 20 pack years would be if someone smoked a pack a day for 20 years or 2 packs a day for 10 years. Also, if you smoke now or have quit within the past 15 years, and the recommendation and eligibility for insurance purposes to get screened is between 50 and 80 years old. So you want to get screened every year if you meet these conditions. So this is just the eligibility for insurance. But if you have any concerns and don't fit into this parameter, definitely speak with your doctor. And the current recommended method for lung cancer screening in high-risk individuals is a low-dose computed tomography or a low-dose CT scan. And this is considered the gold standard for lung cancer screening because it's been found to be the most effective method of detecting tumors before they spread. It provides a detailed image of the lungs and has been shown to reduce lung cancer deaths in heavy smokers. And this test is done because it can spot the cancer in early stages before symptoms develop, allowing it to be surgically removed. And lung cancer has a high cure rate when it's found early. And once symptoms develop, it's generally too late. To find a lung cancer screening near you, visit one of ScreenNJ's partner sites on their website. Screening facilities can also be located through the American College of Radiology. They have a great facility finder on their website. And the American Lung Association website is a great resource. They have a quiz to plug in the risk factors. They also have a helpline. So always discuss your healthcare with your primary doctor before scheduling a screening. So let's talk about colorectal cancer. When we discuss colorectal cancer, it's important to remember that this type of cancer can affect the colon or the rectum. All of these cancers start from a tissue growth that's initially harmless or benign, that's called a polyp. And it's estimated that 30 to 50% of people will develop a polyp at some point in their lives. And if these polyps are not detected and removed, they can turn cancerous. And this can typically take about a decade to occur. And colorectal cancer is the third most commonly diagnosed cancer in the US. It can be one of the deadliest cancers if not prevented or detected within the early stages. And it's the second leading cause of cancer deaths in the US. So colorectal cancer starts as a polyp. In this video, we have a little virtual tour of the colon. So we can see those polyps that you can see popping out of the, they look like small trees growing from the tissues of the colon. So the gastroenterologists can, the great thing about the colonoscopy, if they see the polyps, they can remove them right there and then, preventing colorectal cancer from occurring. So the early stages of colorectal cancer can be asymptomatic, but later stages include fatigue, changes in stool, and stool color turning black, meaning bleeding. You could have bloating, abdominal pain, and weight loss. So you never want to ignore the rectal bleeding. You want to contact your primary doctor right away. Since 1 out of 10 cases of colorectal cancer occur in individuals in their 40s, we use the more conservative guidelines published by the American Cancer Society. And these guidelines recommend that screening start at age 45. Screening should continue at regular intervals until age 75. And at that point, a process of shared decision-making between a patient and provider should take place that weighs the risks versus the benefits of colorectal cancer screening. There's several types of screening tests. There are the stool-based tests that are done annually, a sigmoidoscopy, which is done every 5 years, and a colonoscopy, which is done every 10 years. So let's take a look at each one. The stool-based tests, the first is the fecal occult blood test. And that's used to detect hidden or occult blood in your stool. And it's a simple, putting stool on a card, and the lab applies a chemical to the card. And if the card turns blue, the result is positive. But it's important to remember that a positive test result may not indicate colorectal cancer. And the FIT test, or the fecal immunochemical test, is similar to the fecal occult blood test, but it also looks for antibodies to detect blood from polyps of cancer. And the multi-targeted stool DNA test, branded as Cologuard, is a fecal occult blood test plus a DNA test to look at any altered genetic material from polyps and cancer cells. With the stool test, it's important to follow up with your doctor. No news is not always good news. You don't want to self-diagnose and just think that you're okay if you haven't heard something. You want to work with your primary care physician or your gastroenterologist to determine which tests are best for you at what point. And then the flexible sigmoidoscopy is done in the office of your gastroenterologist. It's a thin lighted tube inserted into the rectum to visually inspect the rectum and the sigmoid colon, which is the last 30 to 40 centimeters of the colon. And the colonoscopy examines the entire length of the colon. So after a clinically significant abnormal screening test, a colonoscopy is conducted to get a full picture. And as always, discuss this with your primary doctor before scheduling a screening. So we want to encourage you to get your annual checkups with your primary care doctor, who will make a referral to a gastroenterologist. Procedures are usually conducted in the office, and under the Patient Prevention and Affordable Care Act, all insurers are required to cover preventative screening tests like colonoscopies. So here are some resources. Once again, ScreenNJ and their partner sites, and the New Jersey Cancer Education and Early Detection, NJ-SEED, provides lots of assistance, lists of screening locations for free or low-cost screening. So again, always check with your doctor before scheduling a screening. In the following section, the last section, We'll discuss controllable cancer risks. As I mentioned earlier, genetics and age can play a role in cancer risk, but we can't control our genes or age. However, cancer deaths can be prevented with screening. Controlling or limiting certain lifestyle factors and environmental exposures can directly impact and reduce cancer risks. And this section focuses on the very early part of the cancer trajectory. I prefer to think of it as before the cancer trajectory even starts. So the first is screening, which we've already talked about. And then in addition to screening, there are real things you can do to lower your cancer risk related to lifestyle. And we'll also mention the environmental risks. So I'm just showing this slide again because I just want to stress again that screening is very important in reducing risks of certain cancers. We know that screening saves lives. It can improve outcomes if you do find a cancer that can be treated earlier. Remember, the earlier in the cancer trajectory we screen, the more likely we are to prevent cancer in the first place. So, did you know that a healthy diet that regulates weight can help reduce cancer? Fat tissue causes inflammation in the body, increasing the risk for cancer. And when it's around the organs, it can increase the risk for breast, endometrial, liver, and pancreatic cancers, among several other cancers. Unfortunately, we're seeing obesity rates increase worldwide. It's not all bad news, though. Intentional weight loss has been seen to reduce cancer risks as high as 78%. So by staying at a healthy weight, it can help us to fight cancer before it even gets on the cancer trajectory. As far as diet, fruits, vegetables, lean proteins, whole grains, nuts and seeds, and water as our preferred drink. Just like there are compounds that can increase your risk for cancer, there are compounds or phytochemicals in our food, which are found in plants that may reduce the risk of cancer. So our cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, mustard greens, kale, they all have anti-cancer effects. There's also evidence that vitamin D can help reduce your risk for colorectal cancer. Just be careful about high heat for cooking and grilling, which can create carcinogens. We also have to watch supplementation. Certain antioxidants, vitamin A and E in high doses can actually increase your cancer risk because A and E are fat-soluble vitamins, as can calcium, which in high doses can increase the risk for prostate cancer. So please always discuss any supplementation with your healthcare provider. So many benefits to getting exercise, moving your body. Exercise isn't just to look good. We know that physical activity is good for your heart, mental state, and that it helps to reduce obesity, which we know is linked to cancers. But did you know that exercise may help to reduce cancer incidence and tumor growth? So just be active, do what you love and enjoy, do it with friends or with music. By exercising regularly, we're working before and in the very early stages of that cancer trajectory. So many people ask me, well, how much exercise and what should I do? You want to get at least 150 minutes per week of moderate intensity aerobic activity. So anything that gets your heart beating, or 75 minutes per week of vigorous aerobic activity, or a combination of both, preferably spread throughout the week. You want to also add moderate to high intensity muscle strengthening activities, such as resistance weights, on at least 2 days per week. And just spend less time sitting. Even light intensity activity can offset some of the risks of being sedentary. Drinking alcohol in excess can increase your risk of cancers of the mouth, throat, esophagus, larynx, liver, and breast. The more you drink, the higher your risk, and that increases if you smoke too. And moderate drinking is okay. It's important to continually reinforce these habits that keep us off the cancer trajectory. Speaking of habits that keep us off the cancer trajectory, smoking is the leading cause of cancer in the United States. And being exposed to secondhand smoke also increases your risk. How many of us have met a non-smoker that had lung cancer because of secondhand smoke? It happens. So quit smoking. It's easier said than done. Smokers who quit before age 40 reduce their chances of dying from a smoking-related disease such as lung cancer by about 90%. And those who quit between 45 and 54 reduce their risk of dying by about 2/3. And smoking is linked not just to lung cancer, but also to bladder, cervical, esophageal, kidney, mouth, nasal, pancreatic, stomach, and throat cancers, and other chronic health conditions. Help is available for quitting smoking. The Rutgers Tobacco Dependence Program and the Robert Wood Johnson University Tobacco Quit Center are available, and they have tools to help you quit smoking. They also have programs available. And the Quit Center will also send you free patches. They have a telephone hotline. They have text check-ins, and you can even get a coach to help you out. So the final risk factor we'll look at today is the environmental exposure. Outdoor air pollution, a mixture of tiny dust particles and substances in the air, right? It can be man-made, like fumes from vehicles or factories, smoke from burning fuels like wood or coal, and pesticide drift from agriculture. It also includes natural substances such as wind-blown dust and radon, which is a gas that can be found in homes. So this particulate matter, the small air particles, are linked to lung cancers, and chemical exposure can actually encourage tumor development by having an effect on normal cells. So here we have a relationship between chemical exposure and the tumor microenvironment. So just to sum up, cancer thrives when it has the right environment. I hope that this presentation, in this presentation, you've had a better sense of how this happens. And we know that several factors can affect cancer risk, and screening can and does save lives. And by making lifestyle changes, you may be able to reduce your cancer risks. So I want you to feel empowered to advocate for health by promoting the screening and treatment that are available to reduce overall cancer incidence and deaths. And just one last time, I just wanted to show you the screening resources available with ScreenNJ, NJ-SEED, the American College of Radiology, and the American Lung Association. If you want to know more about the North Jersey Health Collaborative, please join us on our website at njhealthmatters.org.